You've cut the salt, you've read every label, you've walked every morning, refused the breadbasket, and asked the waiter twice about the soup. And the number on the cuff still has not moved. Your doctor talks about adding another pill. You leave the appointment quieter than you walked in. Let me tell you something I tell my patients every single week. Just because that number is still high does not mean you're failing. The real problem is something almost nobody over 60 has ever been told about. What you actually need is not in a pharmacy. It is sitting right now on a shelf at your grocery store, often less than a third of the price of the salt you already buy. And by the end of this video, you will know exactly what it is, how much to use, how fast it can drop your blood pressure, and the single question to ask your doctor before your next appointment. I'm Dr. Richard James. I've spent more than 30 years helping people over 60 protect their hearts. Blood pressure is the single most misunderstood number in this age group, and it is quietly responsible for more strokes, heart attacks, and sudden declines into nursing care than any other manageable condition after 60. Most of those events do not happen in people whose pressure was sky high. They happen in people whose pressure was only a little high for years. In my clinic, 7 out of 10 patients referred for so-called uncontrolled blood pressure are not the problem. Their treatment plan is. Your blood pressure is not just about salt. It is about the balance between two minerals your body has been losing for years. Here's what nobody in medicine is taking the time to explain. When that balance tips, the strongest low-sodium diet on earth will not fix it. Stay with me, because the fix is simpler than the problem it solves. But before I tell you what to use, I need to explain why the advice you have been given for 40 years, just cut the salt, was never the full picture. Think of a seesaw, one side sodium, one side potassium. For decades, every public health campaign has focused on pushing one side down. Almost none of them have talked about lifting the other side up. And the truth is, most seniors are not standing on a sodium mountain. They are standing on a potassium cliff. Your kidneys at 65 do not filter the way they did at 35. That is not a criticism, it is biology. After 60, the kidneys gradually lose the precision they once had at holding on to potassium and clearing extra sodium. Add in the most common blood pressure medications, the diuretics, and that loss accelerates. Many seniors are losing more potassium every day than they are putting back in. Here is the part that most people get wrong. Sodium, by itself, raises blood pressure, but potassium, in the right amount, actively pushes it back down. And when potassium runs low, no amount of salt cutting can rescue the number. You can throw away every salt shaker in the house. The seesaw still tips the wrong way, because one side has nothing on it. The data on this is not subtle. The American Heart Association recommends adults aim for around 4,700 milligrams of potassium per day. The average adult in the United States gets less than half of that. Among seniors, the gap is wider. Decades of food processing have stripped potassium out of the diet, while sodium has been added back in by the spoonful, hidden in bread, soup, deli meat, sauces, and frozen meals. Look at the modern American kitchen for a moment. A sandwich at lunch can carry 1,500 milligrams of sodium before you even add a chip. A single cup of canned soup can hit 900. A frozen dinner can break 1,200. Meanwhile, the foods richest in potassium, the leafy greens, the beans, the roasted potatoes with the skin on, the bananas, the avocados, the plain yogurt, have quietly disappeared from a lot of dinner plates after retirement. Cooking for one is hard. Chewing a salad is harder when the dentures are not cooperating. Slowly, year by year, the potassium drops out and the sodium creeps in. This is the part that frustrates me the most as a doctor, because the fix was always on the table. It just got left off the leaflet. Picture a representative patient. Let's call her Rose, though she could be any of the women I see every Tuesday morning. 71 years old, retired school teacher in Ohio, lives alone since her husband passed. She did everything she was told, cut the salt, walked her dog twice a day, stopped the deli meat, took her medication exactly on schedule. After 8 months, her systolic pressure had dropped a single point. Her doctor wanted to add a third pill. That is the kind of story I hear in my consultation room over and over. And it is not because Rose is doing something wrong. It is because half the equation has been missing from her plate. Your kidneys are not failing you. Your effort is not failing you. The model you were handed is incomplete. And once you see what is missing, You cannot unsee it. So what is the answer? What is the powder I keep promising you? The answer is potassium chloride. That is it. A white powder, sold openly, that looks like salt and tastes almost like salt. In most supermarkets, it is labeled salt substitute, or light salt. Same shelf as the regular salt, often a third of the price. You may already have walked past it 100 times. You may have seen the brand names: low salt, new salt, Morton light salt, which is a 50-50 blend of regular salt and potassium chloride. No salt. These products are not new. They are not a supplement. They are not exotic. They are food, and they are sitting there in the seasoning aisle, hiding in plain sight. Here is what makes them special. Every gram of potassium chloride you sprinkle is a gram of regular sodium chloride you did not sprinkle. So the moment you switch, you are doing two things at once. You are pulling sodium out of your meal, and you are putting potassium back in. The seesaw starts to even out in a single swap, with no extra effort, with no new pill. But here's where it gets really interesting, because the numbers from the largest trial ever done on this will surprise you. And what those numbers showed is something that has already started to rewrite the guidelines in more than one country. The trial is called the Salt Substitute and Stroke Study, or SSASS. It was published in the New England Journal of Medicine in 2021. It followed more than 20,000 adults across rural China for nearly 5 years. Half were given a 75-25 salt substitute, mostly sodium chloride, with potassium chloride mixed in. The other half kept using regular salt. Nothing else changed. Same diet, same routines, same medications. The result? About 14% fewer strokes. Roughly 13% fewer major cardiovascular events. About 12% fewer cardiovascular deaths. From a change in the shaker on the table. If you remember nothing else from this video, remember this. Your blood vessels do not just respond to what you remove from your plate. They respond to what you replace it with. So how does it actually work in your body? There are two mechanisms running side by side. The first is straightforward. Less sodium in, less sodium pulled into your bloodstream, less water held there with it, less pressure against the walls of your arteries. That alone is helpful. The second mechanism is the one most people have never heard. Potassium relaxes the smooth muscle inside your blood vessel walls. When the vessels relax, they widen. When they widen, the same heartbeat moves the same blood with less force. Pressure drops. Potassium also signals your kidneys to release extra sodium into the urine. So you are not only adding less sodium at the stove, you are also clearing more of the sodium that is already inside you. Two directions at once. Out the top, out the bottom. A pooled analysis of 32 trials, published in the Journal of the American Heart Association in 2020, found that increased potassium intake was associated with average drops of about 4 to 5 points of systolic pressure in people with hypertension. Not in everyone, not always, but often enough and consistently enough that the effect is real and measurable. Now, 4 or 5 points may not sound dramatic, but every 2-point drop in systolic pressure across a population reduces stroke risk by roughly 10%. Multiply that out across years, across millions of seniors, across the morning coffee and the evening dinner, and the impact is enormous. Think about what this means in your kitchen. A reading that has been hovering at 148/88 for years, the kind of reading that earns you a third pill at your next appointment, can quietly drift down toward 142, then 138. That is the difference between a doctor who shrugs and a doctor who pauses. That is sometimes the difference between adding medication and removing one. The number on the cuff is the same number that shows up on every chart, every referral, every form. Move it, and the entire conversation about your health changes. This is the part doctors talk about freely when they are prescribing a new pill. It is the part many of them never mention when the same effect can come from a $4 bag of powder. So here is exactly what I want you to do, starting at your next meal. There are 4 simple steps, and I want you to follow them in order. Step 1. Buy the right product. Walk into your grocery store and look in the seasoning aisle. You are looking for words on the label that say potassium chloride, or salt substitute, or light salt. A 50-50 blend, like Morton light salt, is a gentler starting point if your taste buds are used to regular salt. A 100% potassium chloride product, like no salt or new salt, gives a stronger effect once your palate has adjusted. Avoid anything labeled simply low sodium that uses only flavor enhancers. Those are not the same thing. Step 2. Replace, do not add. This is the rule that catches most people. Use the substitute in place of your normal salt at the stove and at the table. Do not sprinkle it on top of regular salt. If you cook with a teaspoon of salt, replace it with a teaspoon of substitute. If the new taste feels unfamiliar, mix half and half with your regular salt for the first 7 days, then shift fully over. Step 3. Mind the dose. Aim for roughly half a teaspoon to 1 full teaspoon of the substitute across your full day, working up gradually. That is across all meals combined, not per meal. Most people see a measurable drop in systolic pressure within 4 to 8 weeks. Some see it sooner, a few see it slowly, but the change is almost always there if the swap is consistent. Step 4. Track the proof. Take your blood pressure at the same time every morning, seated in a chair with your back supported, feet flat, after 5 minutes of quiet rest. No caffeine first. No conversation while the cuff is inflating. Same arm every time. Do this for 7 days before you start. Then again for 7 days after 1 month on the substitute. Write the numbers down. A simple notebook is enough. Bring both logs to your doctor at your next visit. That number on paper ends every argument about whether something is working. A few small things make this easier. Buy 2 small bags of substitute, not 1 large one, so the powder stays dry and fresh. Keep a small spoon in the bag if your shaker holes feel too fine for the new texture. Some brands clump in humid kitchens. Storing the bag with a few grains of dry rice fixes that overnight. None of this is complicated. None of it requires a special diet or a new appliance. It just requires you to put 1 shaker down and pick a different one up. That is the entire protocol. 1 powder, 1 swap, 1 month of patience, 1 honest conversation with your doctor. Now I know what some of you are thinking, and you are right to question this. Isn't potassium dangerous for older adults? It can be in specific situations. If you have advanced kidney disease, if you take a potassium-sparing diuretic like spironolactone or eplerenone, if you take an ACE inhibitor or an ARB at a high dose, or if you take certain heart rhythm medications, then extra potassium can push your blood levels too high. That is real. And it is the reason this is a conversation, not a prescription from a video. For everyone else, potassium is the mineral the modern Western diet has critically failed to deliver. Some of you are also thinking, my doctor never mentioned this. Is it real? SAS is in the New England Journal of Medicine. The findings have been incorporated into the World Hypertension League's 2023 guidance on dietary potassium. Major academic groups, including investigators at the George Institute for Global Health, have called salt substitution one of the most cost-effective public health interventions available. It is real. It just has not reached every clinic yet. Here is the one question to ask at your next appointment. Doctor, given my kidney function and my current medications, is there any reason I should not switch to a potassium-based salt substitute? If the answer is yes, you have a reason. If the answer is no, you have permission. Either way, you now know what question to ask. And that is more than most patients ever get. I am not asking you to stop any medication. I am asking you to have this one conversation. So let me bring all of this back together. Your blood pressure was never a failure of willpower. It was a mineral the modern food supply stopped giving you. The shaker on your kitchen table decides more of your stroke risk than most people will ever admit. And now, the shaker on your table can work for you instead of working against you. You walked past the answer in aisle 7 100 times. You read the label on every package of salt and missed the package right next to it. You did not need a new prescription. You needed a different white powder. 1 powder, 1 swap, 1 conversation. That is the whole protocol, and it can change the next 10 years of your numbers. You've cut the salt. You've read every label. Now you know what was missing from the shelf. If you are going to try this at your next meal, write "starting tonight" in the comments. I read them, and it tells me which of these videos to make more of. And share this with someone over 60 you love. 1 shaker, swapped tonight, can change the next 10 years of their health. Next week, I'm covering the one blood pressure medication that quietly raises stroke risk in seniors over 75, and exactly what to ask your doctor about replacing it with. I'll see you there. You've worked hard for a long time. You deserve the number on that cuff to come down, and you deserve to know exactly how to bring it there. I'm rooting for you. I'm Dr. Richard James. Take care of your heart tonight.